seen as the use of herbs, minerals, vitamins to heal diseases. That's all.
Just simple, straightforward.
Straightforward.
And the difference between that and conventional medicine
is that one, the alternative medicine healers, they do not use injection. They give herbs to treat all ailments. In the other case, you can give drips, you can give tablets, you can give anything. But for the alternative medicine, I think a sharp difference between the two is that one, patient must be able to take medication. For example, if somebody is in coma now,
all right,
alternative medicine will not be able to help.
It cannot solve that.
It cannot solve that.
Because I just about to ask the question. So is it all ailments that alternative medicine can solve?
Well, all ailments have herbs that can take care of them. That is, if you come early. For example, if somebody's blood sugar is about 600 now, and the person has gone into coma.
All right.
We can't give you any
remedy at that point.
No. So if you come early, I think all ailments.
So is alternative medicine or perhaps traditional medicine, is it safe?
Very safe.
You can convince our listeners this morning?
It's very safe because the difference, the safety we are talking about, the fear of safety that we are talking about is self-imposed by people themselves. So they think, people say this, but you are forgetting that even among the orthodox medicine practitioners, there are quacks and there are professionals who are in the practice.
Right.
And the professionals are known by MBA. They are given certificates. And in fact, in many hospitals that you go to, they are certified as Center of Excellence and Center of Practice in Lagos State.
So you have the same for traditional medicine?
The same thing for traditional medicine.
Ah.
So if you go to a place that is well certified by Lagos State government, you are in good hands.
So some have said that while it sounds very easy for them to believe in orthodox medicine, that for traditional medicine, it's a case of more or less like a guesswork. You know, measurements not very precise and all of that. What's your response to those critics?
Well, my response is this. You find out the orthodox medicine has been around for long. It's not as old as the traditional medicine, but they have muscles and they have money, you know, to go about. And over the years, they've been in publicity of such adverts that this is unsafe, this is not good, this is not this. But today, when you look at when you have an insight into the knowledge that the traditional medicine healers have, you will want to believe with me that those things they are probably they are not very correct. They are misnomer. They are to mislead. They actually mislead the public, you know, so that we will not be patronized.
All right. So what are the core principles guiding the practice of alternative medicine?
Well, the first thing is that, like a medical doctor too, you must have there is confidentiality,
okay,
between the patient and the healer. We are not going to disclose anything, you know, and of course any healer must also be well trained. And before you can be licensed by Lagos State government, all of us were licensed.
Right.
Before we can be licensed by Lagos State government, we must go through their induction course too. And it's over a period of time. I think it's about 3-4 months now.
Right.
Yes. So generally speaking,
there's a process.
There's a process.
All right. So in orthodox medicine, we talk about specializations, right? So we have the general practitioners, we have surgeons, we have those that, you know, are into one field or the other. Do we have that for traditional medicine?
The same thing is present here. We have people who are specialized, who are specialists in mental health. We have people who are specialists in bone setting. we have people who are general practitioners, and we have people whose duty is to deliver babies and to ensure that people get pregnant. We call them traditional birth
attendants.
Yes.
Okay. So you have all of that.
Yes.
But you do not have surgeons.
No, we don't do operation.
So what happens in a case that is very complex that requires surgery or surgical process or procedure?
If there is something that is urgent that requires surgical procedure, you have to go to the alternate. I mean, you have to go to the orthodox medicine and go and do that.
So in that case, there's a limitation for traditional medicine practice.
So also there is limitation for orthodox medicine. For example, Nigerians, you are listening to me. If there is an offer, that is an arrow, a spiritual arrow, thrown into somebody, can injection take it off?
Well, in orthodox medicine,
yes.
That's going. I mean, it's going to be very difficult to prove that there's something that is called spiritual arrow. I mean, it's not something that can be seen physically. So how do you explain that?
Don't they know? They know when they get to them.
You mean it?
Because you don't see anything and the person is in pain. So who is going to do that?
Okay, all right. Let's take this further now and focus the conversation right now on diabetes as an ailment. So, from the traditional medicine perspective, what is diabetes?
Diabetes is just uptake of sugar from the blood, and that system is supposed to be a smooth system that nobody gets to know about it. Once the sugar level in the bloodstream is high, insulin is released. And when insulin is released, the doors of the cells of the body will be opened, and then sugar will enter, and then that sugar level comes down. But when there is a problem in this system, that is when diabetes occur. It can occur. There is the juvenile diabetes, which they don't even have insulin at all.
Okay.
So it's called the juvenile diabetes,
right?
You know, and then we have the gestational diabetes, which is brought about by a woman being pregnant.
Okay.
You know, that one goes away. But the type 2, which is the insulin resistant diabetes, is as a result of the doors of the cells not opening when insulin is released.
All right. So this is more or less like what is similar to orthodox medicine. So it is virtually the same thing for what you...
It's the same sickness now.
So how do you diagnose it?
The same way. You have to go to the lab.
Okay.
You know.
So once it is tested and it is known that this person had diabetes...
No, it's not like that. Once you are tested and your blood sugar goes up, it's not to say that you are diabetic.
Okay.
For example, you might not have slept a night before. You may not have a sound sleep for some reasons, and your blood sugar will go up. So before you can determine that somebody is diabetic, you must have taken the blood sample about 3 different times.
Okay.
Then if the blood sugar is actually high, then you start from there.
If it's consistently high.
Yes.
All right. So from your findings, how prevalent is diabetes in Nigeria?
It's getting more prevalent now.
More prevalent?
Yes.
And what do you think is the cause from the traditional medicine perspective?
We are aware that a lot of people don't eat good food. That's the main reason. And once you don't eat the proper food that your body requires, you're going to have problems.
But food is food, and we have that all around. Don't you think so?
Okay, let me just do this simple analogy. You have 2 pots and you plant maybe corn in the 2 pots, and you start giving one good water, the other one you are giving it warm water. The one you give warm water is being given water, but you will discover that the one will flourish and one will blossom and the other one is not going to do well. The reason is that you are not giving the proper meal to the corn, that particular corn. So it's not a matter of eating. It's not a matter of just taking any food that is filling. It's a matter of eating the appropriate meals. For example, we all eat dead meals.
Dead meals?
Yes.
What do you mean by that?
If you want to eat food that will be good for your body, it has to be a living meal. And many of us, because of the
Cosmopolitan
nature of Lagos, we are on the run, we are on the go all the time. We are not able to eat anything, maybe even prepared in our homes. For example, eating cucumber raw, that's a living meal.
It's a living meal.
Yes. And that cucumber, maybe lettuce and carrot, not for somebody who has diabetic. If you are diabetic and you take carrot, your blood sugar goes up. You know? So if you take other...
Say that again. If you are diabetic
and you take
carrot, what happens?
Your blood sugar shoots up.
You mean it?
Yes. So what we are saying this morning is that if you want to be out of all illnesses or most illnesses or degenerative diseases, try as much as possible to inculcate living meals into your food, you know, so that you eat things that are not actually cooked, and they are recommended like that.
All right, we're going to get back to that, the issue of the living meal, which you just said. Lagos Traffic Radio 96.1 FM, stemming the tide of diabetes disease in Nigeria is our focus. And we have Dr. Leye Popoola, a traditional medicine healer or consultant, as the case may be, and he is founder, Nature Alternatives. Okay, like we said, Asphalt Lane on the service lane from Vokes to Yanoba. So access to Yanoba bypass is already closed to motorists, and consequently, traffic will be diverted to the main carriageway. This is from Barracks. We can also tell you that motorists are advised to connect Lasu Iba Road through Igbo Ilenri corridor. That's the way you're going to navigate through that end this morning. Let's take you through the CBD, that's the Central Business District area, Marina. We can tell you it's good movement along Marina, talking about Inner Marina, from UBA roundabout, Oando filling station, Kakawa Junction, down to Cathedral Church, up to Nitel Junction, all looking good this morning. While Outer Marina connecting State House, inwards First Road is very much in good shape as well. Third Mainland Bridge, descending Flag House, inwards, that's Independence Bridge, is looking very, very good traffic-wise. All the way to Onikom roundabout is looking good. TBS down to Waterboard is also looking good as well. The entire stretch of Broad Street from General Hospital down to Bookshop House, Tinubu Square, as well as Martins Junction, inwards Akpongbon, very much in good shape as well. Even as we speak, no impediments cited, no record of any breakdowns, structure very much intact, doing the needful this morning. All right, then, so I'm going to allow you to join the conversation very, very shortly. But Dr. Leye Popoola, is diabetes curable from the perspective of the traditional medicine healer?
Definitely, a lot of people have been off the hook. But as you are aware, the population of the world, only 1% of the world is in the bracket of a billion of having billion of dollars. You know, it takes a lot of discipline for you to be rich. At the same time, if you want to be healthy, it will take a lot of discipline because it will cause some inconveniences for you.
Right.
For example, what we will recommend if you want to be off the hook of diabetes, a lot of people might not be able to do it.
Like what?
For example, I talked about living food now.
Right.
You could, there are some herbs you could.
So which before you go, so which food do you consider to be dead food?
Okay. For example, by the time you're eating bread, that's already dead.
Bread?
There's absolutely nothing in it.
It's not a living food.
It's nothing.
But it's nutritional.
Well, that will take you to the negative. You know? So, okay. From the perspective of a traditional medicine healer, is looking at what will nourish your body. Your body breaks down, not because you have been taking bad food for 4 years. A lot of people have been taking bad meals in the last maybe 20, 30 years. It will get to a point when it will break down the system, and then you will now start to have degenerative diseases.
Right.
But the moment you change and you start nourishing your body and your cells with meals that are acceptable to the cells, you find them coming back, and whatever problems, ill health that you have, you will overcome it, So what we are talking about here, I'm just mentioning one aspect of it. There are herbs that can also take good care of diabetes,
And bring you to full restoration?
Full restoration.
In terms of cure?
Let me just give the public an idea about what I've just mentioned. When your system is insulin, the dose of your cells is insulin resistant.
Right.
The solution to that is just simple.
What's the solution?
30 minutes walk every day solves that problem. It will enhance the sensitivity of the cells, the dose of the cells to insulin coming.
30 minutes walk
every day for 5 days in a week is okay.
You mean it?
Yes, it solves that problem completely. So if you are diabetic and you are not, maybe your doctor have been telling you, do 30 minutes walk on a daily basis, and you are refusing it. If you refuse that, you will continue to be on medication till you die.
Yeah, but but you have some people who are into routine exercises. They do this that you've mentioned, but it has not really solved the problem too.
What about the meals they are eating? Dead food on their tables after the exercise. It will not help them.
Yeah, but
so it has to be it has to be pari passu.
So let's put it in perspective now.
Yes.
You cannot tell me that rice or eba or yam, those are not dead foods.
They are not dead food, but for us, there is something we call high glycemic meals and low glycemic meals. Any meal that is high in carbohydrate is not very good for the diabetic patient. So if you are a diabetic patient and you are taking eba, you are walking towards the gallows.
All right. Let me put this to you, because we spoke with Alhaji Abdul Wahab Dauda last week. He's the chairman, Diabetes Association of Nigeria. He's been living with it for over 31 years. And he said, you can eat anything. The only do's and the don'ts of living with diabetes is for you not to take, is the drink aspect, probably not drinking alcohol or this kind of, or sugary drinks. He was advocating for just water alone. But that in terms of food, you can eat anything.
Okay. Today, somebody has managed diabetes for 31 years. What you are asking me on this table is that how can somebody
be
cured of diabetes? So that's what I'm saying.
Right.
If you want to take eba, for example, you take a small portion of eba and you take a lot of vegetables, which will slow the conversion rate. That is, for that eba now to be converted from eba to glucose.
All right.
It will take a longer time.
Yeah, but Dr. Popoola, that simply means that the ailment is not cured. If you say that I have to stay off certain foods, that means I am just managing it. And that goes in tune with what orthodox medicine is saying, that you cannot really have a cure for diabetes, rather than for you to live with it. It's a lifestyle.
I'm here to represent my constituency, and a lot of people who have patronized my constituency, they know that they have been cured, and they do not have high blood sugar any longer.
Right.
So we are not here to say that what they are saying is wrong, is not correct. But what we are saying, you must also listen to us with open mind, so that you will see any ailment, any time there is any sickness, and it's the body that that heals the system. Is the body itself must heal itself. For example, if you have something and a surgery is done, the body must heal that place where the surgery has been done. You understand?
All right.
So if the system is not okay, it cannot be healed.
Let's look at some of the things that you use then.
Okay.
We have lots of medical interventions from orthodox medicine. What do you use? You said herbs, right?
Yes.
So for someone who has some cords, for instance, when we say you come down with diabetes, it gets to a point where it degenerates, like the doctor was explaining last week, where it turns to sore. You have a wound and it never heals and all of that. Are you saying that alternative medicine, do they have intervention for this?
Well, yeah, I want to assure you today that why do we have gangrene in the first place? That sore that is not healing is because blood is not circulating properly. Why is blood not circulating properly? Is there any intervention on the side of traditional medicine? Yes, a lot.
Tell me.
We have ginkgo biloba. We have something that ginkgo biloba will ensure that blood goes around the system. We have damiana, which will also help blood to circulate. There are a number of them. There are very many of them that can help. If you look at the kidney, the liver, we have tonics for all this. Shankar Peridra will help the kidney, will help the liver. And once all those things, once they're in proper perspective, the patient will never fall into the pit of going to have gangrene or having wound that is not going to heal.
And then they have to amputate the leg or the hand.
No.
You mean
even when you amputate that leg, as the reason why you amputate the leg, has it been corrected? No. So amputation can still take place even after that. So what we are saying is that treating diabetes or bringing the blood sugar down is not the treatment. The treatment is to also ensure that anybody that is sick does not have other complications that diabetes will present.
All right, then Lagos Traffic Radio 96.1 FM, stemming the tide of diabetes as a disease in Nigeria. The traditional medicine approach is our focus. Dr. Leye Popoola is with us in the studios, and he's taking us to the classroom on how it all works. All right, traffic situation across Lagos still looks very, very quiet at the moment. Do not forget, we heard from our waterla not too long ago of a breakdown, an overnight breakdown at Otedola, but he says it's not really affecting the flow of traffic at the moment. Still, things are still very, very cool and calm for now. No major worries, even as you drive through that corridor. Ikorodu Road as well is receiving with good vehicular flow too, from Odogun to Mile 12, Koshofe, down to Ile. All that corridor still looks good. Same for return journey as well. Still looking very, very good at the moment. Okay then, so it's time for you to also join the conversation. We're talking alternative medicine as a therapy for diabetes. Dr. Leye Popoola is very convinced that alternative medicine can bring cure for diabetes, unlike what we've been discussing from the orthodox medicine. Orthodox medicine believes that you can live with it. It's manageable, it's treatable, but it's not really curable. But my friend here says it is curable from the traditional medicine perspective, and that they've had scenarios of various interventions right here in Nigeria. Okay, if you have any questions for Dr. Leye Popoola this morning, feel free to join us. 080-99-120-777, 09153-877127. Okay, that's 080-99-120777, 09153-877127 are the numbers that you can, reach us on the program, even as we discuss this. And if you have, gone through that route before of seeking intervention from traditional medicine consultants like his, and you've seen the different kind of results too, in terms of the assessment of the ailment, feel free to connect with us on the program as well this morning. All right, so you've given us the difference, and you've mentioned some interventions from traditional medicine, some herbs, as the case may be. You've mentioned some herbs, right?
Yes.
Are these herbs, are they indigenous to us, or
Well, there are other herbs that are very indigenous. I mean, they are available in Nigeria. We have turmeric. Uh, we have bitter melon. It's available here. We also have ewuro, the bitter leaf that we. It will please you to note that bitter leaf was turned into capsule in America about 3 days ago now.
let's take this call.
Hello.
Hello there. Good morning.
Yeah, good morning. I hope it's Traffic Radio.
This is Traffic Radio. What's your name?
Okay, my name is Eddie Asikogo.
Eddie Asikogo.
Yeah.
Where are you calling from?
Yes. I'm calling from Ikorodu.
Ikorodu. All right then, Eddie. Go ahead.
Yeah, my question is, from Orthodox angle, there are two types of diabetes. Diabetes 1, type 1 and type 2. Yeah, from Orthodox angle as well, type 1 can never be cured. And even some kind of medication they do is only on injecting insulin. So my question to my Ogadia is, their cure, is it for both type 1 and type 2? That's my question.
Okay, beautiful question.
Yes.
All right then, thank
Thank
you.
you.
So,
Thank you very much. What we are discussing here this morning is the type 2. And I'm talking about the type 2, not the type 1.
Okay.
Because the type 1, the number of people who have that in any population is less than 1%. Very, very, very minimal.
But can you cure it?
Well, the issue is this. Once the only problem that person has is because the pancreas is not working any longer.
Okay.
It might take a long time, but the person must be on that insulin injection till the pancreas starts to work, if it will ever work.
Okay.
Yes.
All right. I hope that answers your question. Eddie Asikogo from Ikorodu. 08099120777. Good morning. Hello there. Can you hear me? All right, let's see how we cure that as well. Since we're talking about healing, let's see if we can heal that line right now. Talk to me, 08099120777, 09153877127. We're looking at the perspective of traditional medicine in the treatment and cure for diabetes. I have Dr. Leye Popoola in the studios. He's a traditional medicine healer, and he's founder of Nature Healing Alternatives right here in Lagos. All right, so for those that go through this kind of ailment, okay, there are symptoms that they exhibit. Are you saying that by the time you begin to use these herbs and this alternative therapy, these symptoms go away? Is that what you're saying?
Completely, because there are two aspects of the treatment. Number one, something that will bring down the blood sugar. The other one will prevent all the complications that diabetic patients will ever face, like blood is not circulating well, oxygen is not getting to the cells of the body. If oxygen is not getting to the kidney, it means the kidney will pack up after a while. It takes the oxygen there and remove the impurities from the kidney and all the cells of the body. Therefore, anytime any patient is sick and blood is not circulating properly, it cannot have maximum or optimum performance for the cells of the body. So the treatment for to prevent complications is very, very important. But I think what we have been doing all along before now is we have been giving medication just to lower the blood sugar. And it is believed that if the blood sugar goes down, all the other parameters will work. But we have seen situations where blood sugar is normal and then the complications still
remain.
Yes. So we are not giving life to chances. We are trying to say prevent, because the kidney, the eyes, there's something we call eye bright. It handles all eye problems. Bilberry will ensure that
Eye bright?
Yes.
Is that a leaf or something?
it's like leaf, it's once if you get to anywhere where they're selling herbs, they will sell it to you.
Eye bright.
Yes, eye bright. It makes the eyes to see better.
You mean it?
Yes.
You
then
mentioned blueberry now. What's the function?
Bilberry.
Oh, bilberry.
Bilberry.
Double L.
Berry.
Okay.
It helps the arteries to become more flexible and to dilate properly. So if all these things are in place and they are well used as they are supposed to be used, you will find out that there will be no complications for any diabetic patient.
Yeah, but Dr. Popoola, some of these things will also have its own negative effect too on the body. Some of these natural things that you're
Okay.
talking about.
The reason why you are saying this is also because you do not know how nature works.
Tell me.
The reason, aspirin came from what we call white willow bark. It is an extraction from white willow bark. When you take white willow as a herb, you can never have any adverse effect. It cannot affect your blood to thin too much, But because you take the active ingredient from any particular herb, that's when you will have problem. For example, these herbs that you are talking about is just like a wedu or okra. Once you take okra, you mix it with a wedu, you mix it with ogbono. You can have 7 different types of vegetables in just one pot. But the moment you say you want to take the extract from ugu, for example, for blood, that's when there's going to be a problem. Otherwise, you will eat all of them together. There won't be any problem. That's it.
Lagos Traffic Radio 96.1 FM. 08099120777. Revelation from my traditional medicine consultant in the building this morning. And I expect more questions to be flowing from you at the moment. If you're on the road, you might just want to bring that in. The network a bit cranky, but of course we're here to respond to all your concerns. We're talking diabetes this morning, and Dr. Leye says it's something that can't be cured. What's your take? If you've gone to any traditional medicine before now, and you've made use of the alternative therapies, talk to me. Hello there. Good morning. Please turn down the volume of that radio.
This is Yetunde Okpesanwo speaking.
Yetunde Okpesanwo, where are you calling from?
From Ogudu.
Ogudu. All right. So have you made use of traditional medicine before?
No, I just want to make some complaints about my own.
Okay.
I'm on drugs since 2014. Actually, my husband has it before he died. He died 2005.
Okay.
So before he died, I've been noticing some things which I did not take serious. So after my retirement in 2006, I got discovered that the rate I'm urinating is too much. Actually, I have a daughter that is a nurse. She knew, but she didn't want to tell me. So I carried myself to the hospital where they now told me that I have diabetes. Okay, I've been on that drug since 2014. But my own case, I do use this abere.
Okay.
Soak it in the water, take it anytime, once in a day. Even there was somebody from the clinic, because when we go to clinic like that, some people will bring what they are using, if you can try it. So that abere, this, I don't know how to describe it, but if you soak it, very, very, it's even bitter than bitter leaf.
Okay.
But another way, somebody told us in the clinic that you can use it as, when you grind it to powder, you soak it with this coconut oil, the water inside the coconut oil.
Right.
That you take it once in a day also. So all these things I've been using with it. I use it.
And did it improve? Did it help you?
With my tablets and this agbo. Either I take agbo today, I take my drugs to the following day. That's how I've been operating my own thing.
And how's the sugar level? How has your sugar level been, madam?
Hello?
I said, how has your sugar level been? Has it dropped?
Recently, the one I went for is 128 mg. And when my sugar level goes up, I know what I took causes it. At times when I feel like taking mineral. Once the doctor told us that if you want to take a bottle of mineral and you put 10 liters of water inside it, and you are the same person that took that mineral, it still boils down to that one bottle too. So my own case, I don't do it. I take it like that. So I feel like before I ration my food, I take control of my food. But now I see that almost everything we are taking has sugar, carbohydrate.
Right.
Like these things now, in the hospital, they told us that if you want to, this has starch. That if you want to confirm, when we take beans to the grinder, after some time, you should ask them to give us the water separate. After some time, when you remove that water, at the bottom of that water, you see starch. So
Wow.
I now see there is no point. So what I do now is I take anything I want to take, but not as I'm taking before.
Okay.
Like before, I can eat 4 slices of yam or 5, but I do take 1 or 2
Okay then.
with vegetable.
Right.
Eba. I also take eba. The only thing I'm trying to avoid is fufu.
Right.
and
Which is
spaghetti.
very high.
I don't eat it.
Right. Okay then. It's
I
nice.
don't know that.
Right.
Hello.
Hello, madam. Because of time constraint, I wanted you to round off quickly.
Okay, I'll finish.
Okay. All right, madam. It's nice to hearing you and sharing your own experience with us too on the program. Dr. Leye, Popoola, what do you make of her contribution?
Yetunde, thank you very much for this input. I also want to say diabetes treatment, just like I've said, and that I will continue to say in any forum where that I go in this world, is beyond bringing down your blood sugar. Your blood sugar is supposed to be normal, it's supposed to come down, yes, we know, but beyond that, for example, if we want to do any preparation for anyone who is diabetic, we must be looking beyond that. If it's a man, something that because we know that over a period of time, the libido will have gone.
Okay.
Something must be there for libido. Something must be there for the heart. Something must be there for the kidneys. Something must be there.
So you're saying that for people that have diabetes,
Yeah.
there's alternative medicine that can help their libido, because normally
Yes,
they have libido problem.
definitely.
Ah.
And this is giving is a detailed issue. By the time you come to the clinic, nobody's going to ask you a question about that. It's just going to be. And this issue of urinating too much, it is going to be taken care of along with the treatment.
For those who want to connect with you after this program, quickly, how can they do that?
They can do so on 080 330
Right.
69864.
That's 080 330
Yes, 69864.
69834.
Or
080
8864.
Okay, that's 080 330 69864. All
And
right.
they can connect me on Facebook.
Okay.
Leye Popoola on Facebook. The same name on Instagram.
All right, then. It's nice having you in the building this morning. We'll say a very big thank you to you for making it through to the studios. We appreciate you. Dr. Leye Popoola, nice having you. Thank you.
Thank you. Thank you very much.
Okay, so we've tried in our own little way to look at it from all perspectives. Having reflected on orthodox medicine and diabetes as an ailment last week, we extended the conversation this week to look at the perspective of traditional medicine in terms of stemming the tide of diabetes in Nigeria. We have to go. Before then, quickly, birthday shout out going out to Oluwagbenga Oni, who is celebrating his birthday today. Mr. and Mrs. Dayo Adebayo of the School of Parenting, it's a happy wedding anniversary to you on this great day. Kasali Olakunle Latif is celebrating as well. Dr. Taylor is a voice-over practitioner and artist that you cannot ignore. Joe Biden is president of the United States of America. Today is his birthday. Good luck, Ebele Jonathan is former president of Nigeria. Adesina Mutiat Abiola Ni Moshood, staff of Lagos government. Alexis Kelvin Musa is celebrating as well. We're talking about you are daughter to Yahya Kelvin Musa, who's a staff with FIRS. Also, Olasumbo Olaifa, today's your day too. Dr. Charles O. Abiodun, father to Rerelua Abiodun of Lagos Traffic Radio. All right, then. A big shout out to all of you that are celebrating on this day. We have to go. The program this morning has been produced by Mike James. Maximum thanks to Okpayemi Shodunke of our social media team. Our executive producer is Tayo Akonle. You can continue to follow us and continue the conversation on our social media as well. Lagos Traffic Radio 96.1 FM is our Facebook. Our Instagram is Lagos Traffic Radio 961. You can follow me too on my social media platform. Just search for Victor Oteri. All right, till Monday when I make a return on your side mirror, I say have a great day. Bye for now.